everybody, Dr. Stacia here from Infinite Health. I wanted to do a quick video about my daughter's birth for a couple reasons. A lot of people don't even think about how the birth process can affect their babies and their baby's health. A lot of people just think birth is very natural and a fussy baby's normal or having latch issues are normal. Although they are usually very common, it doesn't mean that it's normal. So my first daughter, 3.5 years ago, she was a posterior, so basically she wasn't breech, but she was kind of flipped the wrong way, and my body just was not responding well. And after 3 days of labor, we had a C-section. And this is what her scans looked like a few days after birth. If you can see all this red, which means severe inflammation up at the top of her neck, and that was just from that force of being pulled up out of the uterus. And then the beginning of this month, I had our second daughter, Marin, and at 41.5 weeks, I was done. I was done. I couldn't take being pregnant any longer, so I requested that my doctor induce me. So although it wasn't a completely natural birth, she at least came the way God intended her to come, and these are her scans. Perfect. They're all white. You don't see that inflammation up top at all. My doctor was very hands-off, did not pull my daughter's head, did not, try to help turn her, anything like that. Just let my body do what it was supposed to. And I've had a lot of patients ask, why is that? And the way that I kind of explain it is that natural birth is like a big giant hug. It just kind of squeezes and compresses everything down. And it's like a big giant hug. Whereas a C-section, after they cut the mom opened, they use a lot of force either with their hands, sometimes the forceps tools, things like that, to help pull baby out. So if you have any kind of birth where they're pulling on the baby's neck or twisting the baby's neck, I highly, highly recommend getting your baby checked, because when we have things like this going on with a baby, we can have sleep issues, breastfeeding issues, baby just kind of being stuck one side. Sometimes even when they get a little bit older, if their heads are stuck in a certain situation, we'll notice like a lot of flat spots. And those are usually the kids, who end up with a helmet, torticollis, colic. I think I named everything I can think of. So yes, if you have a baby, or you know somebody who had a baby and they're having some of those issues, or doctor help the baby out, please have them checked by a pediatric chiropractor who's trained in taking care of kids, but who can also do these scans so that if there's anything going on with your baby. We all want perfectly healthy kids, and we all want to give our kids everything possible to get everything out of life. So highly recommend that. If you have any questions, feel free to reach out to me. Thank you.